Hi there, Duncan here, physiotherapist and owner of Life is Movement, here with another exercise video demonstration. I make these videos for my patients here at the clinic. However, if you're not a patient and you find any of this valuable, you're of course welcome to take it and use it as you see fit. Just please make sure you do so safely. So this is an exercise I was showing a patient earlier today and I realized I didn't have a video on it. So here we go. So this is an exercise I like to offer people with any sort of cervical or neck issue. We have various motions of the neck. We call it cervical flexion, extension, rotation, side bending, and then of course sort of combinations of those movements. The cervical spine has quite a large range of motion, and it's useful to stay in touch with that range of motion, because if we start to lose it over time, that process tends to sort of build on itself. And I often see older people in my clinic, 60, 65 plus, and they, over years of lack of use, they tend to lose the cervical range of motion. And this is an exercise particularly to help with cervical extension, looking up to the sky. And it's a really, really nice, gentle stretch. A lot of people find this to be quite a sort of pleasant, nice stretch to do. So, although it doesn't look necessarily pleasant. So that's probably why I feel the need to emphasize that. So what we're going to do is we're going to take a sort of pistol grip with our thumb and forefinger, and we're going to place it right at the base of the neck here. I sort of tend to put it in the kind of nooks just above my clavicle here. Make sure you're not pressing, obviously, into the larynx like that. You don't want to be choking yourself unless you're into that sort of thing. And so right at the base of the neck, above the clavicle, but below the larynx. And what you're going to do is you're going to press in and down, and then you're going to take the other hand. That provides the positioning, and then you're going to place the other hand on top and provide the strength. So this one is for the position, and this one is for the strength. They're just going to press down, not hard, but with a nice little anchor. You can see it sort of maybe kind of cough a little bit there. And as we do that, what we're doing is sort of anchoring these muscles at the base of the neck here, and then we're just going to gently look up. And what most people find is they get around this point, they get a really nice stretch into the front of the neck here. These are muscles that can get quite tight, quite tonic, particularly if you're someone who holds a lot of stress and tension in your neck. These muscles can sometimes use a nice stretch. However, if you just look up to the sky, you might kind of reach the full range of motion before actually stretching these muscles at the front here. So this provides a bit of an anchor point to sort of shorten and bias the stretch at the front of the neck here. So position, pistol grip, above the clavicle, below the larynx, in, down, anchor with the other hand, and stretch up. And as you can see, when I'm anchoring these muscles, my range of motion is quite significantly decreased compared to when I just look up by itself. So try that stretch, nice and gentle. Generally with the neck, I advocate for anything with the neck exercises. I advocate for, think of it as sort of 20 to 30% more gentle than you would other parts of the body. In my experience, it tends to be more easily exacerbated by exercises. So if for your normal exercises, for your tolerable discomfort zone that you're working in, if you're thinking 2, 3, 4, maybe out of 10, for the cervical spine, I think maybe 1, 2, maybe 3 out of 10 discomfort. Try that. We sometimes call this a pistol grip anchor cervical extension stretch. How about that for a catchy name? Give it a go. I hope it works for you.